Ellen's personality is really one of the things that makes her shine. She came to us as a rehab liaison because we had a full house in our speech therapy department. She's a speech therapist by trade and was a solid contributor on our marketing team. When a position became available in speech therapy, she decided she wanted to transition from the marketing department to the therapy department. That was really where we began to see her really stand out and shine. She has just this personality that's always positive. She's very, I would say, solution-oriented and is willing to take on tasks and get them done.
Ellen is not shy to taking on a challenge. She is always willing to help out with anything that's involving making patients better in our hospital. So she volunteers for things like the stroke support group. She makes sure that we have speakers once a month for that event, and it's really touching the lives of those in our community. Ellen's also part of the stroke team to be able to help us with improving patient care in our stroke patient population, which is wonderful. And then Ellen took on the challenge of creating a Parkinson's program in our hospital and making it very effective and very successful. So she's leading that initiative to help patients in our community that have Parkinson's disease that really need our care that we provide. She's also really active in our nutrition team, which helps with all the nutrition processes in the hospital and making sure that we're really providing that top-notch quality care for patients to make sure that they're safe with their feeding and that they get adequate nutrition. So Ellen touches a lot of things, and she really makes a massive impact on everything that she touches.
Ellen came to see Jim, and he couldn't speak or swallow. He had a feeding tube, and she started doing some basic exercises with his face muscles and with his neck muscles to see if he could start to swallow. So we've come a long way from not being able to even sit up to eating, drinking, talking. Part of Jim's life prior to his accident was always going out and dining and meeting with friends, and now we're finally getting back to that.
My grandmother, my mom's mom, suffered a stroke when I was actually in graduate school, and she had a really hard time speaking. And so when I was in school, I wanted to know how could a speech therapist help her. My other grandmother, who had Parkinson's disease, and she struggled with speaking and with swallowing, and I wanted to become a speech therapist so that I could help these populations recover. So I am passionate about working with the adult population that have neurological disorders, largely because of my grandmothers. You know, I hope that I make them proud of me and I honor them with the care that I provide to people in a similar situation they were in. As a speech and language pathologist, we do more than just help people communicate or speak. We work a lot with people returning to eating and swallowing. We work on their cognitive abilities, whether it's returning to work and being able to remember or think through a problem, and of course their speech and their voice, finding the right words, being loud enough to, talk to your loved one.
Ellen, thank you so much for all that you do for our hospital and all that you've done, and congratulations on this well-deserved recognition.
Congratulations, Ellen.